Welcome everybody. Christian Mission Hospital Rajshahi, Nursing Institute, Mission Hospital Rajshahi. I am Mohammad Jamaluddin, guest teacher, Basic Science, Christian Mission Nursing Institute Rajshahi. Now we discuss about minerals as potassium. That's are very essential for our human body. So what is potassium? The potassium is a mineral and electrolyte. It is found in foods that we intake every day. It is very essential for body function. You know, electrolytes. Electrolytes are the ionized or ionizable constituents of living cell, blood, or other organic matter. We take some salt, such as sodium chloride. If sodium chloride dissolves in water, it is separated in two parts as sodium plus and chloride minus. These are electrolytes. Yes, the source of potassium. The source of potassium, a high potassium source rich food are as banana, melons, orange, nectarines, mango, peppers, prunes, pomegranates, dates, dried fruits, and dried figs. Other vegetable sources are avocados, broccoli, Brussels sprouts, sweet potatoes, parsley, pumpkin, vegetable juice, wheat potatoes, winter squash, tomato and tomato-based products, deep colored and leafy green vegetables such as spinach or Swiss chard. So dried beans and peas, black beans, refried beans, baked beans, lentils, legumes. Other sources are as milk, yogurt, nuts and seeds, bran and bread products, chocolate, granola, molasses, peanut butter, salt substance, etc. Some fruits and vegetables that are very low in potassium, as in fruits, apple, blueberries, grapes, grapefruits, peaches, pears, pineapples, and the vegetables are asparagus, cabbage, carrots, celery, corn, cucumber, eggplant, green or wax beans, green peas or beans, lettuce. Other sources are as rice, noodles, pasta, bread and bread products, angel cake, yellow cake, pies without chocolate or high potassium fruit, cookies without nuts or chocolates. The function of potassium in our body is very important. It's play a very role in our body function. So potassium is a very important mineral for the proper function of all cell, tissue, and organs in the human body. It is also an electrolyte, a substance that conducts electricity in the body, along with sodium, chloride, magnesium, and calcium. It plays a vital role in maintaining a health. Along with sodium, it regulates the water balance and the acid-base balance in the blood and tissues. The pH factor is a very important in our stomach and other intestinal function. So potassium control our pH and it is called acid-base balance. Electrical potential gradient created by the sodium potassium pump helps generate muscle contraction and regulates the heartbeat. So it is very important. Potassium is very important in cellular biochemical reaction and energy metabolism. It participates in the synthesis of protein from amino acid in the cell. So the potassium function is very important in our body. Now, what happens if a low potassium level or deficiency syndrome of potassium? Lots of syndrome express the potassium in low. In a hypokalemia, the level of potassium in blood is too low. A low potassium level has many causes, but usually result from vomiting, diarrhea, adrenal gland disorders, or use of diuretics. A low potassium level can make muscles feel weak, cramped, twist, or even become paralyzed, and abnormal heart rhythm may develop. The figure shows Each figure shows the causes of and symptom of deficiency of potassium. So, what happens if potassium is high? When I have too much potassium in our blood, it is called a high potassium or hyperkalemia. Having too much potassium in blood can be dangerous and often causes a heart attack or death. So, potassium should maintain our body. Symptom of hyperkalemia, these are dyspnea, nausea and vomiting, fatigue and weakness, chest pain, frank muscle paralysis, paresthesia, palpitation, muscle weakness, absent or depressed tendon reflexes. The figure shows. So how can raise potassium level quickly? If potassium level is very low, we should take potassium rich food regularly. The best way to increase her potassium intake is by eating more potassium-rich foods such as banana, avocados, apricots, squash, lima beans, peppers, mangoes, potatoes, spinach, mushrooms, etc. How we can diagnose potassium level? A doctor can perform a simple blood test to determine a person's potassium level. The test involves taking a small blood sample from a vein in the hand or arm. The doctor may sometimes recommend additional testing, including further blood tests to check the levels of other electrolytes such as phosphorus, calcium, and magnesium. Urine testing to determine how much potassium is passing out of the body. Further tests may be necessary depending on the person's medical history and symptoms. The figure shows how test is performed. And the treatment of a hyperkalemia or hypokalemia. The treatment of potassium deficiency will depend on person's symptoms and how low their potassium levels have become. For people with mild hypokalemia, a doctor may recommend stopping or reducing the doses of any medicine that can cause low potassium, taking daily potassium supplements, eating more foods rich in potassium, such as fruits and vegetables, taking medications that can increase potassium level in the body, such as angiotensin converting enzyme inhibitors or angiotensin receptor blockers. So, this is the function of potassium. We should take regular and the right amount of potassium intake in and regular take fruits and vegetables that are contain potassium. So thanks a lot. Best of luck. See you again.